Hi, my name is Edie Carlisle, and today I want to talk about conventional therapy for cancer versus alternative therapy. I'm going to make mention that in the last 100 years, cancer has really increased. We're not sure exactly why, although it could be our diet. It could be the fact we use so many things that have pesticides or have been sprayed with pesticides. We use so many chemical toxins even to clean our houses and our apartments. We are using things that were not used 100 years ago. So this could be one of the reasons. I will research that better and I will talk about that in another video. But what I want to mention is that most people, when they are diagnosed with cancer, whatever form of cancer it is, panic immediately because they assume that it is incurable. And there are, of course, cases that have been incurable, but cancer can be cured. There are alternative ways to actually get rid of cancer, period. Not just put it in remission, but actually be cured of it. But the traditional way of treating cancer today is strictly the same big three that it's been for at least the last 50 years or so. That is with surgery, chemotherapy, and radiation. The problem with surgery is unless it is an organ that can be totally removed or something that can be totally removed, there is a great possibility that the cancer will come back. In most cases, cancer has metastatized and spread, and if you have just one cancer cell left, it can go down your bloodstream and get into some other organ or some other part of the body. That is predominantly why they still insist on using either chemo or radiation even after you've had surgery. Now, chemo and radiation are carcinogenic and can cause cancer. And if you've heard anything about people being treated with either one of those, they can only be treated for a short time, and then there has to be a time in between weeks, a month, 6 weeks, 2 months, before they can be treated again. And during that is so that the immune system doesn't kill the patient, because the immune system will have been killed and or weakened so that it is not possible for the immune system to cope with any problem, let alone cancer. And of course, during this time that they are not being treated with either radiation or chemo, the cancer has the opportunity to continue to flourish and to grow. Whereas, of course, if you're taking a treatment that is alternative, and there are many of them, and I will discuss many of them through different posts or different videos, because I want people to realize that there are possibilities of being cured. There are many alternatives, and all the alternatives, since they are all non-toxic, can be used for the rest of your life. And you will have to change your lifestyle of eating and perhaps even getting more sleep, treating your body better, but it is well worth it. You will not have the pain that traditional therapy gives you. You will not have the side effects that traditional therapy gives you. You will not lose your hair. You will not have other organs that get affected if they're in any way even remotely near the treatment. They can get affected and actually die. I want also to bring out the fact that the Cancer Society the American Cancer Society has even stated that, as even currently, because this was actually stated in 1996, that 1 of 2 or 3 people in their lifetime will have life-threatening cancer. Now, you've probably heard that the AMA and the FDA and the cancer societies, the different ones, are claiming that the cure rate is approximately 40 to 50%. That is a fallacy. I will explain how they have come up with that, how they have falsified records or put things in a certain way to be able to claim that, but it's really not true. All of them say that a cure is anybody who has survived 5 years. This is how they are defining cure. Now, there are cases, in fact, one that happened in Texas, that the husband of a woman who died 2 weeks after her 5-week time was up of when since she had been diagnosed with cancer, and as long as she survived that 5 year, she was put in the cure category, even though she died of cancer 2 weeks after the 5 years. This is how they are falsifying that particular thing. Another thing they are doing is separating whites from non-whites. They have it as a totally different category because non-whites, usually because of economic circumstances, and they can't have the treatments as much as the whites because of economic reasons, and therefore they don't live the 5 years. They are not even put in the statistic of cure. They are just totally separated. Also, anybody that does not live through the treatment, let's say you're meant to be treated for 100 days, of which you will have maybe 15 days of chemo, 15 days off chemo, 15 days of chemo, 15 days off chemo, depending upon what the doctor decides, depending upon the type of cancer you have, the stage of the cancer, etc. Well, if you die before the 100-day treatment that they have decided is what you need to have, they don't count you at all. You're not in their statistics. Another way they do it is they say that if you have skin cancer, curable skin cancer that is not life-threatening, or you have some other type of cancer that is not life-threatening, they put you in the cure statistic because, after all, they can cure that very easily, and it's not life-threatening anyway. But this is how they have come up with the 40 or 50%, and of course it is a fallacy. This is also why many oncologists will not have or allow their family to have traditional treatment. Sometimes they actually leave the country. I have been acquainted with 2 that have actually left and taken their family member to Germany to be treated there with alternative types of treatment, because in our country, insurance does not cover alternative treatments, and therefore it's cheaper oftentimes to go to a different country and have the treatment done than what it is in this country. So even oncologists are aware that the way they are treating patients is not a safe way. But the major problem also is they are not taught any other way except for the big 3, the surgery, chemotherapy, and radiation, of which I call cut, burn, and poison. Now, I've researched, once I was diagnosed with cancer, I spent 8 weeks spending at least 12 hours a day researching everything I could find, and I still research, and now I am, I was informed that I had cancer in June. I treated strictly alternatively. I still have all my hair. People tell me I look very healthy. I feel very healthy. I still have plenty of energy. That has not decreased. And I truly believe that my cancer is diminishing. I have not had thermography. I will not have a mammogram or do any more PET scans, etc., because they are, again, giving you radiation in order for them to be able to use those products. So I don't believe in that, and therefore will not have any more of those. I did have a biopsy, actually in both breasts, because I have been told that cancer is in both breasts, so that I did allow that, but I have not allowed the lumpectomy, the mastectomy, or anything else that they asked, or actually didn't ask. They demanded that I have. The other thing is many state laws prevent doctors from giving you alternatives. This is also because of economic reasons. Many hospitals have spent lots of money on big equipment, etc., and in order for them to be paid back and to make a profit from it eventually, they want people to use them, and therefore they have very powerful lobbyists, etc., and most, in fact, maybe all the states have laws that you can, a regular oncologist or doctors are not allowed to talk about alternative treatments. So they are penalized. Some of them are actually, their licenses have been removed. There's one in Texas that his license was taken away, and he now still treats people, but not as an MD. He treats them, I don't remember what he calls himself now, but anyway, the laws are difficult for doctors to get by. There are many, many alternative ways through diet, through supplements, through herbs, many ways of curing cancer. One of the major things you have to do, though, is you have to believe that you can be cured. You have to have the mindset and not panic and not believe that it's a death sentence, because it doesn't have to be a death sentence. And I will even do some videos or written posts and talk about mindset and give you ideas of how to change your mindset if you do have fear or you do have the belief that cancer is definitely a death sentence. All right, I have done my video for the day, and I would like to have you look into a product that will help with your mindset. Underneath this video in my blog, I will put a couple of links of what you can perhaps look at. And you don't have to, or you can just look into it and see if it's something you're interested in. My main purpose of doing these videos and my post is really to teach people that there are alternative ways of curing cancer, and I will get into other diseases as well, because some of the alternative ways of curing cancer also cure other things. So until the next time, I wish you well. Godspeed. Bye-bye.